Hello and welcome to the Meet Your Health Coach podcast. I am your host, Claire Sharpen, and I've been looking forward to recording this episode for quite some time. So today you're going to meet Dr Ekaterina Karpova, a former GP and now a health coach who specialises in chronic disease prevention and specifically in cancer prevention. You undoubtedly know people who have been or are on a cancer journey. Perhaps you're a cancer survivor yourself. If that's you, or if you just want to get to know how to approach reducing your risk of cancer, this episode is for you. I'm glad you're here. This isn't about fluffy, airy-fairy stuff. You'll be hearing from a medical professional who's going to explain what we mean by cancer prevention, which, to be honest, I think isn't something we hear about enough. You will also discover how health coaching has a role to play in disease prevention of all kinds, and the first step you can take to support your own health. I'm going to be sharing this episode with people I care about, and I hope you will too. As a health coach, I found there are many things I wish I'd known earlier, and this is one of them. Hello, Katya. Welcome to the podcast. Thank you so much for joining us today.
Oh, hello, Claire. Well, thank you very much for inviting me. That's a pleasure to be here.
So, do you want to just briefly introduce yourself?
Yeah, my name is Ekaterina, actually, but that's really long and complicated. So many people call me Katya, which is shorter and easier. I live in Scotland, in a small town called Forres. It's very beautiful, and believe it or not, it was awarded as the prettiest town in Scotland many, many times. So yeah, we have gorgeous nature and mountains and sea and everything. So.
Lovely. Sounds good. So, Katya, you and I trained together as health coaches. We did our health coaching training together. And I know that you originally qualified as a GP. So it's going to be really great to talk to you today about your medical background, also about health coaching, and then the area that you're now specialising in as a health coach. So what I'd love to start with is just what is it that led you to move from being a GP and in various different areas of medical practice to becoming a health coach?
Yeah, it has been a very long journey. So yeah, I always loved science. I loved biology. I loved medicine. I really wanted to help people. And so I was trained as a medical doctor, as GP. I was quite passionate about it. But pretty much straight away after my training, I started to notice quite a few problems with the system. So I saw people coming to me over and over again, getting the medication, but not really getting better.
Right.
And I felt, well, it should be something else that I could do for them. So then I found this idea of food as a medicine, which sounded really fantastic. So I started to study nutrition, and I have been doing it for a really long time. So I ended up studying in Wageningen University in Netherlands. So I did a few courses on health and nutrition and different non-communicable diseases, which was very exciting. And there we started to talk about prevention. And that really was the beginning of a new journey. So I started to think, wow, there is actually something that could be done for people not to get ill in the first place. But from just trying to manage the symptoms, actually we can do something to prevent quite a lot of diseases. And that really changed my direction of work. But then I encountered another problem. So I thought, wow, I'm such a fantastic professional. I'm going to tell them what to eat and how to behave and what to do. And then they will do it and they will get healthy, but they didn't. I just noticed that people didn't really do what I told them to do.
Yeah, people don't, do they?
They would give up quite quickly. They would maybe want to change their diet and to want to change their healthy lifestyle, but they couldn't. It didn't stick. So I just thought, there is a problem here. And then I found health coaching.
So how is health coaching the difference then?
That was the answer to all my questions, actually.
Right.
How to make it work. Not just tell them what to do, but how to change their lives so it would be sustainable.
So, as a medical practitioner, how would you say health coaching has a role in preventing and indeed reversing chronic lifestyle diseases like Alzheimer's, dementia, like diabetes, heart disease, autoimmune disease, those sorts of things?
Well, it's extremely important, and I wish all GPs would be able to do that because GPs, they just have 7 or 10 minutes
Yeah.
to talk to the patients. They can't spend hours talking about healthy lifestyle or the diet or how to integrate it to their lives. They might tell you a few words like, oh, you need to lose weight, or you need to change your diet, but that would be it. Or you are given some leaflets with some information. But that's just so difficult.
Mm.
So very few people actually start doing it.
Mm.
So I think healthy lifestyle coach should be in every health center in the country.
Mm. And how does a coach bridge that gap between, like you say, the leaflet, the information,
Mm.
and actual lasting, sustained lifestyle change?
Well, ideally, every patient, every client should have at least 4 or 6 sessions with a health coach to discuss their unique situation, to make a plan, to develop all the stages, how they're going to reach their goal, and then to have support during their journey.
Mm.
So that would be an ideal case scenario.
And what about when they come up against barriers or they fail to do what they intended to do? How does health coaching make a difference in that scenario compared to just being told what to do?
Well, that's the main role of health coach, actually, to help them to overcome the difficulties.
Mm.
Because of course, there are lots of difficulties. Even like making a tiny little change in your life, it's difficult, it's hard,
Mm.
So that's what health coaches are supposed to do.
What would you say to a GP or some other medical professional who's perhaps listening to the podcast about the role that health coaching can have with their patients who might be suffering from chronic disease?
Well, I think the role of health coach is absolutely essential. So if somebody has, let's say, high cholesterol or pre-diabetic situation, or any changes that show that they might develop some very serious life-threatening disease, immediately at that very moment, this person should be referred to a health coach to do some very essential changes in their life to maybe possibly prevent developing this very serious disease,
Mm.
or even somebody is already ill to help like managing cholesterol, for example, or I don't know, all kind of things that can be done alongside the traditional treatment.
So, my next question is, do you think things are changing? Have you seen changes in the medical profession over the last 5 to 10 years in how medical professions are taught and how they perceive nutrition and lifestyle factors in treating and managing chronic disease?
I have seen a lot of changes, which I'm very happy about.
Mm.
But first of all, there is a new profession which actually sounds so exciting that I'm thinking about doing this training, which is called lifestyle medicine, prescribing lifestyle medical different tools, like also exercises, diet, and other things that can be prescribed like GPs would prescribe you medication. So this is something that possibly is going to be a separate profession, or maybe it could be GPs that got this education and they're going to work with their patients and help them.
Mm, yeah. So you think there is a shift? Because I wonder whether nutrition and lifestyle is still seen as a kind of nice to have, if you like, rather than as foundational to health within the mainstream medical profession. What do you think?
Yeah, it's definitely changing.
Okay.
And I'm really happy about it. For example, with cancer prevention, there is a very famous book which is called Anti-Cancer. So the author of this book, he is neurologist, so he's medical professional. And 30 years ago, when he started to talk about cancer prevention with different lifestyle changes, people laughed at him.
Yeah.
They thought he was nuts. But nowadays, you can do all kind of courses on cancer prevention from big organizations, American, European, cancer society research groups, all kinds of stuff. And they're actually working on it all the time, developing guidelines for people how to prevent cancer.
So I'd love to hear more about what you've learnt around cancer prevention. Can you give us a sense of what's meant even by cancer prevention? We talk a lot about cancer and treating cancer, but what's actually meant by cancer prevention?
Well, what we can talk about is statistics, obviously, because nobody knows. There is still no answer what exactly is the reason of each particular cancer. I learned at some point that every second person in the UK will get cancer diagnosis during their life. So, which is 50% of our population, which is huge. So, but the good news is that if you follow guidelines from different leading organizations about cancer prevention, you can reduce your risk of getting cancer by 40%.
Wow.
Which is also a lot. Or you can get, even if you got cancer at some point, you can reduce your risk of cancer, of dying from cancer by 45% just by sticking to the guidelines.
Right.
I think it's amazing.
Right. So what are these guidelines is the obvious question.
Well, yeah, there are quite a few. I'll just mention a few. Well, the first and the biggest one is maintaining healthy weight. This is very important because obesity increases the risk of quite a few cancers. Also, reducing the amount of alcohol, and ideally not taking any alcohol whatsoever. Quitting smoking. Important. And there are quite a few recommendations about healthy diet and physical activity and being in the sun and things like that. So quite a few.
See, it's interesting, isn't it? Because I wouldn't associate ordinarily cancer with diet and exercise necessarily. Could you talk us through a bit more how perhaps you as a health coach could help someone who's perhaps has risk factors, increased risk factors for cancer in addressing those? So what kind of approach would you take? Where would you start?
Well, first of all, we would discuss what kind of risk factors this person has. For example, it could be family history, which is the most popular one, but then could be obesity, then could be other things. So, and also what particular cancer is specific for this person's high risk, like, you know, what kind of cancer. And then we would look at possible risk factors for this particular person. And then we would make a plan what can be changed.
It's baffling, isn't it? Because I have several friends who are at different stages of a cancer journey, and my perception is that they already live a healthy lifestyle. So what about those circumstances? Are there other factors, perhaps environmental factors, that also can impact on cancer risk? What do you think?
Of course, of course. It's like I was thinking about metaphor about getting cancer and reducing the cancer risk. So I would say, if you tell me, if you always cross the road when the traffic light is green, can you guarantee that you will never ever get run by a car? And of course, you can't. There is always a chance. There's something might happen, and there is genetic factors, environmental factors. There are things that you can't change. And you can have ideal lifestyle. You can be physically so active and perfect diet, and you still get cancer. It is possible. However, we can do our best. We can do everything we can to reduce this risk.
Yeah, and how about things like stress as well? Because I know as a health coach, stress is often talked about as having a massive impact on health. Is there any sense of correlation between things like stress and mental health and risk factors for cancer?
There is a lot of anecdotal evidence that actually stress does affect your risk of getting cancer. It's not on the main guidelines. It's not, if you go to World Health Organization guidelines, for example, stress is not going to be one of them, like not one of the risk factors. However, there is a growing body of evidence that it does affect our health quite a lot. So it does affect our immune system, first of all, for example. An immune system is the one that is fighting against cancer.
Yeah.
It can increase the level of inflammation in the body. It can affect our environment, our environment in our body quite a lot. So that's, so there is no direct causation. However, there is very possible correlation.
And so where do you think cancer treatment and cancer prevention needs to head in the UK? If you could wave a magic wand, what would you want it to look like?
Well, first of all, I would love to provide, with other health coaches, of course, free health coaching for every cancer survivor. And I think it's quite essential. So people would be given this information, and not just information, but support as well after they finish their cancer treatment, just to get this feeling of, I know what to do, I know where to go, I know what I can do to reduce my risk of secondary cancer as much as possible. So that would be fantastic. And I think it would be great if it is provided by big hospitals or cancer charities, but it needs to be free for everybody. And then, of course, people with high risk of cancer, or just pretty much anybody, it should be in our health centers, it should be everywhere. It should be, but unfortunately, it's not here yet.
So there's a lot of conflicting advice out there, isn't there, about what constitutes a healthy lifestyle, what you should or shouldn't do. If you had any advice for anyone listening, specifically about maybe where they could start to think about changes to make in their own lifestyle to reduce the risk of cancer, what would be a place someone could start?
Well, I think probably the easiest thing to change, well, by easiest, I mean easier to understand, it would be changing your physical activity level, because I think the guidelines are quite direct, so there's not too many opinions about it. And that affects your cancer risk quite a lot. So it's fantastic way to boost your immune system, to reduce the level of inflammation, to balance your hormones, to boost your mood, So I think if you want to hear numbers, so that would be starting with 150 minutes of cardio activity, for example, like jogging or walking per week, which is not so difficult really to achieve. Just brisk walks every day, 30 minutes. It would be already a fantastic start. And then increasing it if you want.
Taking it from there. Yeah, it's interesting, isn't it? Because I think exercise has been perceived as just being about fitness and how you look and all this kind of superficial stuff. But actually, if daily exercise has a significant impact, can have a significant impact on reducing cancer risk, that's massive, isn't it? Yeah, particularly with such sedentary lifestyles that so many of us often lead now.
I've heard a fantastic expression which I really loved. So if exercises could be a pill, so it would be the most prescribed pill in the world. It basically would be prescribed to everybody.
Yeah, and we would all take it. Yeah. So it's really exciting hearing how you think things are changing in the medical profession, and changing more broadly around prevention of disease. And then we've talked a bit specifically about your area of expertise in cancer prevention. Where do you think things are heading for the prevention of chronic disease, across this country?
Well, I hope that, first of all, people get knowledge about it, especially medical professional. They will get this course of lifestyle medicine in the medical universities, in the colleges. They would be aware about it, and they would pay more attention to it, and they would educate their patients.
But then, like you say, there is this challenge that people know quite a lot of stuff. You can be informed and educated. It's the transformation that's the challenge, isn't it? So, yeah, I mean, something we're trying to do with Vital Health Coaches is make health coaching more accessible and available and visible for people to access to enable that lifestyle change that we know, like you talked about at the start, is really difficult to do on our own. So that's something we would love to see happen for sure.
Yeah, it would be fantastic if it happens on the populational level, not just few private clients. If everybody would be aware about it and would actually want it, that would be great.
Okay, so Katia, people can find you on vitalhealthcoaches.com. You've got a profile on there as Dr. Ekaterina Karpova, and you've got information on there about the services that you offer. It's been really interesting talking to you and gaining your perspective from a medical background, and now as a certified health coach, and as someone looking into cancer prevention and supporting people with cancer prevention. So thank you so much for your time today. Thank you for joining us on the Meet Your Health Coach podcast. It's been a great pleasure.
Well, thank you so much. It was great to be here. It was a privilege. Thank you for inviting me.
We hope you've enjoyed this episode. For more on how a health coach can support you in your health journey, please go to vitalhealthcoaches.com.